Thank you, Jan. This is kind of a commercial slot about the white paper, and I could actually be pretty brief and just say the white paper is essentially a summary of many of the things which have been presented today. And yeah, go out and read it. There's the QR code. You have the QR code also on your tables. Hopefully it's the same one. But nevertheless, I will take a few minutes, and I try to be brief, to give you a little bit a layout of the relevant or most important aspects of that white paper. And it was also a little bit mentioned already that there has been much this talk about yesterday and today about the FHIR profiles, the content specifications, the format. But as it was mentioned, to really be able to implement this in products, to deploy products in the field, there's more to that than just a format specification. It requires also to specify how the products are supposed to interoperate with each other. And essentially, that's one of the main aspects why IHE feels that there is additional value with bringing additionally the IHE concepts into the play there and augment the existing specifications or the specifications which are currently in work with these concepts. And IHE in general always starts per the IHE methodology with a use case. And this is not the use case which was also mentioned a couple of times, like use case is diagnostic imaging report. Yes, that's a broader area, but the use case is more the specific use case. What do you want to do with this diagnostic imaging report? And how you can communicate it between different systems, and what's the reason for doing that? To implement these use cases, of course, you have to make use of a couple of base standards, the technology standards, to structure the information, to transport the information over the wire, to code the information. So you have all these building blocks that you need to somehow integrate and juggle. And the major building block of this is, of course, nowadays FHIR, and FHIR profiles created out of the FHIR space specification. But there are lots of other standards, and IHE per se is standards agnostic. It just supports and explains how to make use of these standards building blocks to implement a specific use case, and to, in the end, really ensure system-wide interoperability between all the products which are deployed in that specific scenario. IHE does this by creating specific interoperability specifications, which explain how to combine these building blocks. And in addition, these specifications are again a building block, a larger building block, which can be used in various combinations to address various use cases which have some similarities with each other. And as was mentioned, I don't know how many times already, of course, there's the important aspect of conformance testing, but also having this conformance testing already ingrained in the concept of that specification, because if you have just some arbitrary specification, it's then often very difficult to determine what kind of testing is really required to have the proof that a product really adheres to that specification. So in this context, so this IHE methodology is really described in more detail in an ISO technical report. So that's not something that is vague, but there's really an ISO technical report for that, in which then the specifications in the IHE context are then the so-called IHE profiles. Unfortunately, there's a little bit of name clash between a FHIR profile and an IHE profile. They're two completely different things. And as was mentioned many times, the conformity testing can then happen during connectatons, projectatons. Marcello is just out. It remains to be seen, especially in the context of the self-declaration or self-certification of the vendors, how much projectatons are in the end really necessary in the context of the EHDS, also regarding the labeling. but this is a concept which is available in the IHE continuum in principle. A very important aspect, however, regarding the specifications is the IHE profiles, in contrast to some arbitrary specification, have a very well-defined structure and very well-defined content, which really helps extremely the vendors, the developers within the vendors, to make use of these specification and to implement the relevant things in their product, and also makes it much more easy to derive the necessary tests out of these specifications. So it always starts with a larger business scenario, might be diagnostic imaging report, which has some relevance, and then specific use cases around that diagnostic imaging report. And it additionally defines actors and the interactions between these actors. These actors can be, or usually are, then implemented in products to ensure that the products can properly interact with each other. And these interactions are called transactions in the IHE context, which have then the detailed specifications. Like you would make use of a FHIR RESTful call, for example, to transmit a diagnostic imaging report in a certain way to the other product, or make a query to a system in a certain way via a RESTful call to be able to retrieve what information is actually available on that system. And additionally, of course, it's necessary to have the definition of the actual content, which is mostly the focus of many of the discussions actually, like the FHIR profile in the context of the IHDS, which describe what is the information which is to be transported on a high level, on a logical level, but also on the detailed technical level. And in the context of the EHDS, it will essentially be a combination of FHIR profiles and IHE profiles. IHE profiles essentially which make use of FHIR profiles. And additionally, the methodology allows to have also derived definitions on the regional or national context, so that great international specifications which have been created can be adapted in a defined way to the local needs. And as was also discussed in some of the presentations, there's currently alignment going on, for example, with IHE Radiology on the international with their specifications. At the moment, unfortunately, due to the timelines, this is going on in parallel, but the normal procedure would be that if there's an international specification existing and we have some special needs, for example, on the European level, these specifications can then be augmented in that framework that IHE provides. Yeah, the testing continuum was mentioned quite a couple of times also in these sessions already. Just what I'd like to mention, also this exists since many years and has been well established, also especially well established within the vendor community. So most of the vendors which are active in this area have participated already in connectathons. The people at the vendors very much know how to participate in a connectathon, to participate successfully in a connectathon. So this is a very well-established mechanism. So it is of great advantage for the EHDS, for XDEHR, for the Commission to make really use of this mechanism. One additional point, however, I like to mention also on the diagram, like the IHE pluggathons in the very early phases, also for the product development. And this is indeed an extremely important aspect because product teams cannot estimate what they have to implement if they don't have at least some experience with what is required, and only then they can create a project plan for the further product development. So the product teams have to get early access and early experience to what is required, and the pluggathons are a possibility for this. And this is again the plea also to XDEHR. Pluggathon are one aspect of that, but also having access as early as possible to the documentation, to the ideas which are currently in discussion is extremely helpful for the vendor community also to build up capacity, to build up knowledge, and also to give feedback regarding the feasibility of the implementation. Unfortunately, XDEHR has some constraints regarding making the concrete specifications available early on before the consultation phase. But there have been many discussions now to set up additional possibilities and discussion rounds in community to at least exchange the current ideas before the formal consultation is then finally starting. What was not shown on the slide deck as previously, but kind of mentioned, of course, there needs to be some infrastructure, some framework behind it. IHE provides that Gazelle testing framework, which is a test management tool for the one side, mostly used at the connectathons, but it also integrates many other testing tools, which can also, to a certain degree, used by vendors independently of the connectathons to test their products, which is also extremely helpful. And yeah, supported by IHE Catalyst. Initially, the idea was to have the presentations the other way around, but since Claudio had to leave earlier, we have been doing it this way. The other important aspect is that this testing continuum, especially like the connectathon activities, provide quality control testing artifacts. So that's really some things vendors can be built on, but also the user community, the procurers can build on to have some information that what the vendors are claiming that they can do has really run through some thoughtful testing. And there's also the mechanism of the so-called IHE integration statements, which kind of augment or supplement the ideas of the X-Share label, where there is a very concise document which describes the capabilities of a certain product for a vendor. There's also on the fire side, of course, there are fire capability statements, but which are very technical statement usually. These are documents which can be very easily used in procurement to allow then procurers to understand which products provide which functionality. In addition, there's currently the idea to have this label which kind of collects all the relevant information in the EHDS, and these integration statements can be also a basis for that. So in summary, IHE Europe has a long experience in EU activities. Also, since going back to EPSOS times already, was a key member of the first pan-European interoperability specifications, has been recently active in quite a few of the other projects set up by the European Commission, and to drive forward in the end then the European health data space. And just recently, IHE Europe has entered a statement of understanding together with HL7 Europe to commonly drive the necessary specifications from the SDO side for the European health data space forward. So looking very much forward from the IHE Europe side to continue all these discussions and also to contribute in the end to specifications which can really be easily implemented and provide or support the success of the European health data space. And with this, I end again with the QR code to the white paper. Thank you.